Hi, my name's Scott McGann with the Falmouth Health Department, doing a COVID-19 update for July 23rd, 2021. As many of you would know, that we've been doing COVID-19 updates up until mid-June, and as the cases had sort of died down and vaccine information was pretty stale, that we took a hiatus for it. But we've had some cases this week, and we've had some calls and some misinformation and so forth. So I wanted to do another presentation. We'll continue to do these weekly as conditions change. If you want to call the health department, we're at 508-495-7485. Our email is health@falmouthma.gov. And the website where we post our most recent information is falmouthma.gov. So I'm going to start out with cases this time because that's what most of the concern's been. So as of yesterday, when I do these data, I always stop at Thursday night for consistency week to week. There's been 1,592 cases since the beginning of the outbreak. There have been 9 confirmed cases this week during the period from up to July 22nd. For the month of July, we have 17 cases, which is definitely up from 3 in June and I believe 44 in May. So we are having an uptick, and mainly since the 4th, so right around the last 2 weeks. We've had 2 probable cases this week. That's the rapid antigen. They count as probables, and 6 in July, for the month of July. They're not necessarily additive because some people will go from the rapid antigen and also get a PCR, so those numbers would show up in both sections. So we've always been sticking with confirmed cases. Our percent positivity has gone up with the increase in cases to 1.44, down from up from 0.42. So we have had an increase. I've had a lot of calls on numbers a lot higher than what they have been, but they are concerning because we are seeing an increase. In terms of our chart, we do this weekly chart. This shows every case since the beginning of the pandemic. You can see since roughly June, it was pretty flat at 0, 1, around in that area, but you can see the last 2 weeks that we've had between 5 and 10. Over the last 2 weeks. So, and as far as we'll talk about variants in a minute, yes, it is Delta. Delta is now probably, the last time I checked was 83%. It's probably 90 by today. So there is Delta variant. How PCR tests work, they don't check for variants. The state pulls samples and then does monitoring for different variants. It's a specialized process, I believe only done at certain labs, like the state lab in Jamaica Plain, so that not everyone's tested for a particular variant, but we know the variants are here. It's definitely assume it's Delta, and I'll talk about Delta in a minute. This shows our curve, flattening of the curve, a term that we used a lot in 2020. You can see that we've been pretty flat, but on the last dot on the far right, you can see a bit of an increase. We're gonna have to keep an eye on it. So that's kind of where we've been with cases. County-wide, this shows all the county cases. You can see on the far right, you can start seeing an increase week to week. So Falmouth being no different from others. We'll talk about the Provincetown outbreak in a minute. But you can see that we've had an increase over the last 10 days, 2 weeks to 10 days, 10 days to 2 weeks in cases. Hospitalizations are been, had been around that 3, now we have 5. Statewide, I'll talk about that in a minute, has not seen an increase in hospitalizations at this point or deaths, so that's good. It shows that the vaccine works. I mean, the vaccines were never 100% effective, and so, but they are very, very effective with hospitalizations and deaths and the seriousness of COVID. And even with Delta, the vaccines are still very robust for those 2 things. So, hopefully we continue as we monitor the hospitalizations that stays at a manageable to low number. The lower the better, of course. So that's the numbers so you see 6.8, 6.16, 7.7, and 7.21. It hasn't been a remarkable change. Yes, there's 5. It's a little bit higher. We've been seeing that numbers, that 3.42, 3.4 for a while now. So we're going to keep an eye on that. Statewide, it was nice when we were seeing 50, 60 cases a day. Now we're into the hundreds. It was like 200 the other day. Now we're at 300, 400. The positivity obviously is going to go up as a result. It's over 1. It was down around 0.4, 0.5. But hospitalizations and deaths are not necessarily, deaths always have a lag to it because if somebody's getting it over the last couple of weeks, sometimes it takes a little bit, unfortunately it takes a while. But I want to look at the trend charts. You can see in the upper 2 columns, you see at the right, the blue. That's showing an uptick in cases, which is also going to be corresponded with testing. You see an uptick, but on the bottom two, you see them relatively flat. That's hospitalizations and deaths. So the vaccine, especially when I talk about Delta, may not be as effective as it was with, so let's say, quote-unquote, regular COVID or B117 COVID. Hopefully these trends continue. And I don't want to see cases go up, but definitely don't want to see hospitalizations and deaths, and as long as if that flatlines, that's a good thing. I'm going to talk a little bit about vaccines, and then we'll get into Delta in a minute. So vaccinations, it's still real easy to get a vaccine. The county, this is the percentage of individuals with at least one dose, is up 2% from the last time I did this presentation on 6/15. We're at 76. Cumulative percentage of eligible individuals, those over the age of 12, with at least one dose is up at 83%, which is a 2% increase from 6/15. And percentage who are fully vaccinated by total population is up 3% to 69. And I'll talk about Falmouth. If you look at Falmouth, we're at a total of 76% first doses, 70% fully vaccinated. That's for the entire population. If you adjust it, taking out those under those that are not eligible, we're at 84% at least one dose, 77% are fully vaccinated. Again, above average. We've been above average in this point. If you haven't been vaccinated, you're one of the 9,000 or so that have not been vaccinated. With the Delta being much, and I'll talk about that in a minute. You may want to rethink that. It's your decision. But that's where we are for vaccination rates. Availability, you go on the Mass Vax Finder, all the pharmacies will come up. There's plenty of doses. For example, we did at the fairgrounds this week, we have a vaccination clinic with Johnson & Johnson at the fairgrounds. The homebound thing, call the health department. I think we should have you call the health department right now. We haven't had a lot of calls on homebound. We think we've got everybody done who's requested a homebound visit for vaccination for those who can't make it to a clinic. If that happens, you can actually call the health department at 508-495-7485. I think right now with the senior center just open, call the health department. We can work directly with them. Sorry, I didn't have a chance to update that slide. So again, 495-7485, call the health department if you are seeking a homebound, or you have a relative or somebody who's homebound and cannot get to a vaccination site like a CVS or Walgreens and so forth that are there here in Falmouth. But there are plenty of doses available. Talk about, we've been in the news a lot. Barnstable County, there was a Provincetown cluster, roughly about 256 cases, with about 100 of those being residents of Provincetown. So outbreaks are happening. About 66% of those were fully vaccinated, with 60% being symptomatic, most cases being mild, 3 with hospitalized, 32 different businesses were identified. So, COVID can still spread with Delta, but the vaccine is effective at keeping you where we want to be, which is not really sick. So you've been reading that in the paper. That has happened. It hasn't really. 5 cases are from other Cape towns, so we're not seeing a lot of that spreading here anyway in Falmouth. A little bit about the Delta variant. This is what I've pulled off, looking at different websites and so forth. 80% of the U.S. cases in a very short time. I think we're 83 last time I looked. I've heard about 150% more transmissible than the original and about 40 to 60 more than the B117. On average, people infected with Delta variant had about 1,000 times more copies of the virus in the respiratory tract. So I've used the word viral load in previous ones, especially last year. The higher the viral load, the quicker the vaccine has to work and the quicker you tend to get symptomatic. And also more people will get it. So what happens is people that aren't vaccinated, there's a much higher viral load, so that even those that are vaccinated, will pick up a high viral load to start. So it's got a, sort of a jump start from the original COVID. And then we'll have a tendency to show symptoms. And but the vaccine appears to still be effective in stopping it from getting out of control in your body. It's the virus doing what viruses do. We have the same issue every year with flu, where we're formulating they're formulating the flu vaccine in the summer for ready in the fall. But by the time the fall gets there, it's different. It's changed. It's the different strain. It's the dominant strain, and you're trying to fight it that way. And that's happening with the variants here. We don't have full vaccinations of everybody throughout the globe. We have pockets in this country that still don't have high vaccination rates. Most countries still don't have high enough vaccination rates, so it leaves the virus to mutate. Some are more spreadable, and definitely Delta is. Delta is here. I guess the silver lining is that you see that we've had an increase, but it hasn't been, I want to go back to that slide previously. What we haven't seen at this point, let me go back to the slide, is if you look at, so let's say 4.2, 423 section, where we went from 30 to just under 100 in 1 week. So we're not seeing that. That would be from vaccination, knowing that this virus is more, transmissible. This was mostly the B117, virus here. Without vaccines, then you would see this, and actually we had guidance back then. We had masking and restrictions. It still was able to make that, with nothing going on, no restrictions and no masks, this would be a much bigger number, in my opinion. So, we know the vaccines work. Now, in terms of the vaccines themselves, there has been some breakthrough. We knew there'd be some breakthrough. We have seen that recently. There'll be some cases that get it. They seem to be mild for the most part. They weren't 100%. It's a bit lower. Some studies have showed in the 80s or so. I've heard different numbers from different, obviously we got to keep an eye on it. Delta came pretty quick, and what each vaccine is, I think they still doing some research on what the true efficacy of the different vaccines are. But there, we have seen in Falmouth vaccine breakthrough, more so recently with Delta than we did previously when it was the other version. So, we'll see where we're going to be with that. Again, it's not necessarily about the COVID. It's really about the serious disease hospitalizations, and right now they seem to be holding okay. These slides are subject to change. This is what I've learned about Delta. Again, that's where it is. So as a little bit of a recap, the guidance went away on May 29th. I have not been told anything by the state that new guidance would come in. In Provincetown, they issued a mask advisory. In Falmouth, we've already had the mask advisory. They've somewhat of a similar thing. In P-Town, they didn't go with a mask mandate. We have a mask advisory. We already have it in place. All right. Everybody knows vaccine eligibilities for anyone over the age of 12. I highly recommend people get vaccinated. Falmouth resident vaccine rates are much higher than, let's say, the rest of the country. They are similar to other Cape Towns. There's plenty of vaccine available. Take advantage. State metrics are showing an increase in cases, but not at this point in serious illnesses. Delta is the dominant strain. I've got some calls this week that they thought Delta was here. If the country's right now, it was 83 earlier in the week, let's say is 90 by the end of the week, yes, it's here. And so, take that into consideration. Vaccine breakthrough does occur. It still appears to be highly effective in preventing severe cases. There's been a nursing home in another town, and actually had a few cases here. It does seem to be somewhat effective. Obviously, the older you are, the weaker your immune system is, and you might have been vaccinated in January or February. The strength of that vaccine may not be quite there. So, the state hasn't really given us any indications about the future in terms of vaccinations. Obviously, we're still trying to vaccinate the population, especially other parts of the country, to start talking about, a third shot or something like that. So they really haven't gotten into that with the health agents at this point. Again, Falmouth cases count has a 2-week uptick. We're 17 for the month when we had 3 previously. Is that an indicator that things are all going, sideways? Not necessarily. A couple of them might have been 3 family members, unvaccinated, or, an individual who was vaccinated. So not necessarily at this point. It's obviously I'd love to see it 0 and not have to do a presentation, but that's where we're at. So again, more to come. We're going to keep an eye on it closely like we have been. We haven't gotten much from the state about, doing anything than staying the course that we are on. Delta is here, no doubt about it. And so we're going to keep monitoring it. And again, if you have any questions, you can call or email the health department. And that's the presentation for today. We'll be doing another one next week. I think I'll do these weekly. until things, as I have things to report. I think it's behooves me to do this every week, and we'll continue on with it. So I'll see everybody again next week. Thanks.